You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. My first guest says nobody should be wearing a loose-fitting denture. With us, we have Dr. Andrea Smith. Dr. Smith, welcome to the program.
Thank you, Randy. It's a pleasure to be here. Thank you for having me.
Now, I know you brought a lot of photos and some models, so we'll get to as many of those as we can, but for people that don't know your practice, who's the typical patient coming in for this type of treatment?
My typical patient falls into two categories. First, there's the denture wearer that's been wearing dentures for many years, and since they've been wearing them for so long, they have become more and more loose. Each time they go in to get them reset or relined, they find that that is no longer helping. So they heard about us, they wondered how they can receive a stable denture. The second category of patient is that patient who has not been to the dentist for a while. They have loose teeth, they have missing teeth, they have been told that they have gum disease, and in some cases they've been told that they need a denture, but they have heard some of the horror stories of loose, ill-fitting dentures, and they refuse to go down that route. And they heard about us, and they know that in one afternoon they can come in with loose dentures and leave with very stable dentures that do not come in and out or move around when they're trying to eat.
So where you are there a lot of people even wearing dentures?
Yes, Randy, there are thousands of people that are wearing dentures. And for instance, in our community, they are building a new center for the Sacramento Kings. That center, it's called the Golden One Center. It is going to house about 17,000 fans for a sporting event. I know for sure that we can fill that stadium 2 to 3 times with people that are wearing dentures and are in need of some type of stability with their teeth. And we could fill that stadium about another 10 to 20 times with people that are headed to dentures.
So if it's so good, mini implants, right? Why isn't everybody doing it?
A lot of people don't know about it. For instance, if you are a denture wearer, chances are you have not been to the dentist in 5, 6, 7, 8 years. And so this option has never been presented to you. And in fact, the last time you went, you were going to get a reline or a sore spot adjusted. You didn't really want to be there. And you didn't really have faith that the denture reline was going to work, but you went because that's the only option that you have. But here's the other reason they don't come in, Randy. It's because before they had all of the teeth removed to have a denture, they went through 10 to 20 years of having a root canal, a failed root canal, a crown, a failed bridge. And so when they finally had all their teeth removed to receive the denture, it was a relief. So the last person on earth that they want to see is me.
Is that right? Well, that makes sense. Nobody likes going to the dentist. I mean, you seem
not
nice,
many people.
Right?
Right, but not
many people. Do they say
people.
that still? They'll say, hey, no offense, doctor, but...
Absolutely. My most common comment that I get is, I like you, but I don't like the dentist. I get that a lot.
Do you have a comeback after all these years?
No, actually, I haven't. I don't. None that I can think of right now.
But they're afraid of the dentist. I mean,
they're really afraid of the dentist.
So I guess it's tough getting those people in, these denture wearers.
It's really tough getting them in. But when they hear about us, either on the internet or through an advertisement that we send out, we are telling their story. They hear what we're saying, and so they are very apt to call at that point.
Now, you've told me, we've talked, that you believe you're transforming their lives by just giving them teeth.
Just giving them teeth, Randy? Actually, I am giving them a large part of their life back. I can tell you there are people who haven't been able to eat food comfortably for years. The denture wearers in particular, they really don't chew their food. They mash their food, and it's not very enjoyable. With the palate being covered, they cannot feel the temperature of the food. They can't taste the spices. They don't know what it feels like anymore.
Now, in your office, you say that people can walk in on the day of their procedure with literally teeth that are like coming out, right? Bleeding gums and all. And on the day of the procedure, you can extract teeth and give them teeth on that same day.
That is exactly what I'm saying. I actually have one of my patients that I brought in to show you today. She came in with her teeth in a cup. She had them made about 2 years ago and says she's never worn them once. I took them out in order to assess them to see if they were indeed a fit for her mouth, and they were. And when I informed her that I could fit those dentures to go over some new implants in just one visit, she was ecstatic.
So what do you call them, by the way? Like snap-ins, snap-out?
We call them implant retained dentures.
Okay.
Implant retained dentures.
What could they eat with these?
Oh, they could eat, theoretically, anything they want. The corn on the cob that they've been craving, that is my #1 request. Can I eat corn on the cob? Can I have a steak tonight? And those are the things that they've been wanting to eat for years, and they just honestly have not been able to.
What about chewy things like pizza?
Oh, pizza? Yeah, exactly. They can have pizza anytime they want. They are able to bite through it. The teeth are strong. They actually feel like their own teeth. Let me show you the person I was talking about who walked in with her teeth in a cup. Literally, she had not worn them in a few years. Actually, she had never worn them before. They were only a few years old. And I was able to take her same dentures, and in one afternoon, I was able to stabilize them with about 6 mini dental implants. So with her, Randy, I could have just given her a better fitting denture. However, she had never worn the denture that she had once.
Never.
Never, not even once. And in fact, when they went in, her daughter was with her, and her daughter said, "Mom, you look really good with teeth." And she says, "Well, not those teeth." And I assured her, these exact teeth, I can use those to make your smile, to give you your smile back and your ability to eat. And now look at the after, Randy. The picture says it all. When she had those teeth in where they would stay in and they didn't come out, she was so happy. Of course, she stood up and gave me a hug. And actually, while I was on this trip, her daughter, who hadn't seen her in a while, actually called my office to tell me how happy her mother is with her new teeth. That was just this weekend.
How old can you be to get this done?
Actually, there is no age limit. The oldest patient I've done this procedure on is about 97 years old.
Really?
Yes, she's
Why would a
97 years
97-year-old want to do this?
Because a 97-year-old wants to eat, and she wants to talk, and she wants to socialize. Listen, when I had my 97-year-old grandmother, one of the things that we would do is bring her food all the time.
Yeah.
And if she couldn't eat with us, she would be missing out on a large part of that social experience. And so eating was very important to her. The other thing is, I have patients who don't want to be admitted into a hospital for fear of having to release their teeth and give them to be put with their belongings. And the last thing they want is for a visitor to come into the hospital and see them without their teeth. This is her first smile in a few years. Now, I don't know what her teeth looked like before, but her daughter tells me that she never smiled. She was always at the dentist's office, and the day that we put those teeth in, it literally changed her life. In fact, they went out to lunch that same day.
You could eat that day?
You can eat that day, yes. They're just that stable.
So statistically, though, if you're 80 or whatever, are they more likely to fall out?
The implants or
Yeah,
the dentures?
the mini implants, I'm sorry.
Okay. No, they're actually not more likely to fall out. In fact, there's been a 10-year study published in one of our journals, the Compendium, that followed the stability of these implants over time, and they compared them to the more conventional implants, and they had the same success rate, about 95, 96% success rate. So no, the answer to your question is absolutely not.
I have doctors, knowing you're coming on the show, and they always warn me, they say, "Randy, the problem with mini implants, they're too small. The problem with mini implants is that they're not there yet. That traditional implants, the bigger implants, are better." What is your response to that?
My response is there is a 10-year study, Randy, that's been done that has proven, that followed about 5,000 implants, and the success rates are comparable.
Okay.
And so that's behind us. The other good part, Randy, is that they are a lot less costly. They are about half the cost of the conventional implant.
Okay.
So not only are they half the cost, there's less surgery involved, there's less downtime, and even people that are medically compromised can receive this procedure.
What does that mean, medically compromised?
They may have some issues like diabetes. They may have some issues like they may be taking blood thinners. They may be on lots of medications that make them not feel good every day. Okay. And so if they are healthy enough to come into that office, into my office on a particular day, they are usually healthy enough to sit there and receive that procedure.
But isn't it true, though, that if you've been wearing a denture like 10 years, you don't have enough bone to do this?
No, Randy, that could not be further from the truth. These are my patients. They are denture wearers. They've been in dentures for many, many years. There's Rose. She has only recently lost her teeth. And so she still has a lot of bone, but those dentures need to be attached to something in order to function for her.
So do you believe this is the future of dentistry, where a typical denture that's just on adhesive, they'll all be attached to something, whether it's 20 or 30 years from now?
Absolutely, Randy. I think that is the future of dentures. In fact, we don't even have to wait for the future. We're doing it now every day in my office. We are stabilizing those teeth, and those patients are getting back the lifestyle that they have missed for all these years.
We were talking about this in the green room, that people hear about you through a lot of your direct mail about mini implants.
Yes.
And you said sometimes they still come in skeptical, that, you know, like asking you, could you really do this?
Yes, that patient that's usually skeptical will probably already have had a consultation at another office. And we are telling them that we can do something that's going to be just as good for a lot less cost. The other skeptical patient comes in and say, well, I've never heard of this before. How is it that these small implants can do the same thing that the larger implants can do? And I assure them, I tell them about the study. I give them a complete consultation showing them exactly what we're planning to do. And it doesn't take long. This is good news for them.
So no more dentures. You
No
think
more
you could
dentures.
wipe out all the dentures in Sacramento?
I'd like to
eventually?
try, Randy. I'd definitely like to try to do that.
We're going to take a quick break. We come back. More of the photos that
Okay.
you have. You're watching The Wellness Hour. I'm Randy Alvarez. We'll be right back.
When a patient comes into my office and they're unable to eat properly or they're dissatisfied with the appearance of their teeth, it's important to me to get them past those issues and have a major impact on their life. I'm a general dentist, but my practice focuses on mini dental implants. Mini dental implants are a less costly and less invasive way to replace missing teeth and to stabilize dentures.
Dr. Smith did my whole top teeth with implants. They look great. I'm very happy. She is extremely professional. I think she does artwork, really. She's always concerned about my welfare, and I love her staff.
This is the bone preparation for a larger conventional implant, and this is the bone preparation necessary for a small mini dental implant. Mini dental implants are used for single tooth replacement as well as multiple tooth replacement. Mini dental implants are used to stabilize dentures, and it snaps in place, eliminating the need for denture adhesives. My practice also focuses on a new technique for treating gum recession called PST. This is a new way to treat gum recession that is less invasive and less painful than conventional gum surgery. If you're suffering from missing teeth or gum recession, please call our office today for a free consultation and let's sit down and talk about how we may help you.
You're watching The Wellness Hour. I'm Randy Alvarez. Today's topic, replacing missing teeth with mini dental implants. With us, we have Dr. Smith. Dr. Smith, welcome to the program.
Hi, Randy. Thanks for having me back. I appreciate it.
Now, with the mini implants, can you give somebody that comes in without teeth a permanent set of teeth or a fixed set of teeth that don't come in and out on the upper and lower? Like
Yes.
just a full arch of teeth that don't come in and out?
Yes, we can give them a full arch of teeth that doesn't come in and out, and it can be done on the top arch and the bottom arch. Yes, absolutely. I have a patient that came in the other day, and his dentures were very, very loose. And he was very skeptical because the consultation that he had prior to coming to see me involved a lot more surgery and a lot more time and a lot more expense. And so when I told him and showed him exactly what we can do to achieve that goal, he was very excited and we got started right away.
Now, with traditional implants, they talk about giving a full arch of teeth on the upper and lower that don't come in and out. Can you do that with mini implants?
Yes, you can definitely do that with mini implants.
Have you done it?
I've done it lots of times with mini dental implants. In fact, there's a patient that I have who is a scuba diver, and her chief complaint is that her denture comes out when she goes underwater, and her goal was to have teeth that don't come in and out. She was wearing an upper denture, and we simply placed the mini implants. She has a full set of teeth that don't come in and out, and she's able to scuba dive without an issue.
But that's what people want, right? I mean, they don't want something that has to come in and out, even though you say it's good, but ultimately, that's what they want, right? Teeth that don't come in and out.
They want a fixed set of teeth that don't come in and out. In fact, this patient here, she just wanted a fixed set of teeth that didn't come in and out when she scuba dived. If you look at that picture, those teeth look, they're a fine set of teeth. However, they come out when she scuba dives. So in order for her to meet her goal of being able to scuba dive comfortably, we were able to fix those teeth.
She looks happy in the after, right?
She looks very happy, and she is very happy. She tells me all the time, she goes, "Oh, Dr. Smith, I can really scuba dive now without my teeth coming out." That was her goal.
And as far as eating, are these strong enough
They're
to
very
like
strong.
bite like raw vegetable in the front teeth?
Yes, we live in California, so it's all about raw vegetables in California. You can eat your broccoli al dente. You can eat al dente pasta. You can eat just about anything that you want. Nuts. You have the whole gamut of foods at your disposal.
Now, what if you have bad gums and you have teeth that are loose? Can you do this? Can you get this done?
Yes, you can absolutely get this done. Usually when those teeth are removed, the bad gums go along with it. And once everything heals, we're able to place the implants and give them a full set of teeth.
Is that your typical patient, by the way? They come in with really bad teeth?
Yes.
So they still have some left.
Yes, my typical patient has probably more than 50% of their teeth remaining. However, they've had failed gum surgery, they've had failed root canals, and they're just sick of their teeth. And so once we are able to get those teeth out and the gums are able to heal, that bad gum infection that caused most of their problems throughout their life, they're automatically gone as well.
And then what happens? Then you could give them
Then we can give them a full set of teeth that don't come in and out. In fact, Randy, I actually extract teeth on the same day. I place implants in the healthier bone sites, and we give them a nice set of temporary teeth. So they never go without teeth at all.
And then how soon can they eat?
They can actually eat the very next day. I mean, that very same evening.
Okay, then what about pain during the procedure?
During the procedure, there's no pain because we give them local anesthetic. Everybody's different, Randy. Some people may have more pain than others, but I usually tell them to take an Advil or a Tylenol, and usually a combination of that will get them through the night.
Are there some people that say this was a lot less than I thought it was going to be as far as pain?
Absolutely. Almost, I'd say about 90 to 95% of my patients expect it to be a lot worse than it actually is.
Okay, good. And you can do it quickly. I mean, in one afternoon.
In one afternoon.
Okay.
Yes.
Now, what else do you have?
I have this young man who came to see me on Christmas Eve. Now, generally, I don't work on Christmas Eve because my birthday's over the Christmas holiday, but I happened to be in town because I was having some equipment installed. He came in because he broke his front tooth and he had a New Year's Eve party to go to. So I asked him, if you can step over the dust, come in and I'll fix your front tooth. Well, I fixed his front tooth, and a few months later, he came in, and actually at that visit, he says, you know, I've been neglecting my teeth for years. I've been told I needed dentures. I never wanted to have them all out. And within a few months, he came in and we gave him a set of fixed teeth on the upper, and we are actually in plans right now to do the lower, and he couldn't be happier.
So when you say teeth, you're giving them like a full arch of teeth that are locked in.
A full
that
arch.
don't snap in and snap out.
That's right. A full arch of teeth that are fixed into place, and they do not come in and they do not come in and out.
He looks happy.
Yeah.
I think you told me that these mini implant patients are like the happiest group of patients.
They are. They are the happiest
compared
group
to the other dental type patients.
They are the happiest group of patients, Randy, because we are changing their lives. We're giving them back a part of their life that they lost many, many years ago. That grandmother who can now enjoy every social event where she's getting cookies and cakes brought by her kids. That patient who knows she has to go in the hospital, but she wears dentures and she doesn't want to relinquish them so that the visiting family members will see her without her teeth. We give them back their life.
And they tell you that.
And they tell me that. They tell me that specifically.
Is it more men or women?
It's probably more women at this point. However,
guys put things off, or what's your take on this?
I think that guys put it off, and what I've been finding is the guys will send the wives in first to make sure that what we say is actually true.
Is that right?
Yes. And I also have lots of patients who have memories of their parents when they lost their tooth. I had a patient that came in that we did a full set of teeth that don't come in and out. She actually had a lot of her remaining teeth. But her memory was when her mom had her teeth out, she came home black and blue. She couldn't eat for several days. Her face was swollen, like a pie. And she just knew that was going to happen to her. And when I saw her the very next day and her husband, they were both in amazement. In fact, her husband said, while she was sleeping, I had to go in and pull her lip back to make sure you had done something.
Is that right?
Yes, that's exactly what happened.
And you say, now you're a dentist.
Yes.
You probably think the smile's pretty important.
Not only the smile, the function of the teeth, the way you're viewed by people. There's certain teeth that you look at and you make some type of a judgment about them. When you see a lot of missing teeth or a lot of broken teeth, there are a lot of patients actually that are on medications that cause their teeth to be broken and brittle and they crumble. When you can take a patient like that who's been so embarrassed to smile because of their medical conditions and you give them back a full set of teeth, you've really given them their life back. Their life really just begins at that point.
One of the things that we talked about on the telephone is that you say when people have really bad teeth, that they're discriminated against. Like maybe they don't have money or they're not very intelligent. Do you find that with patients?
Actually, they believe that. They believe that they have been guilty of being stereotyped in that way. I have a patient here, for instance, who was on a lot of different medications, and it caused her teeth to crumble and become very brittle. People will accuse you of...
Oh, my goodness.
Of doing things that you don't do. And it's simply, medical reasons why your teeth are crumbling. And sometimes your medical conditions prevent you from receiving the treatment in a timely manner. And so they are judged. They're being thought of as though they don't have money.
Is this her smiling right here?
Yes, when I asked her to smile, that's the smile I got. But wait till you see her after. It's a total transformation.
Let's take a look.
And she loves it.
Wow. So these are like her own teeth.
They are like her own teeth. She eats. They do not come in and out. She eats everything that she wants. She is ecstatic. I'll never forget when she received this set of teeth, she said, oh, I can go start applying for jobs again. It literally gave her back an aspect of her life that she had given up on simply because of her teeth. I'm sure having that new set of teeth gave her the self-esteem to go out and apply for a job. She had more charisma. She was just more accepting of herself. She did not mind looking in the mirror. In fact, she couldn't put the mirror down.
So when they look at themselves in the mirror for that first time, they get choked up?
They cry. They very often cry. And then the very next thing they want to do is to jump up and give me a hug. And
Is
they
that
say,
right?
oh, Dr. Smith, you have no idea what you've done for me. Yes, I get that a lot. That's what makes my job a lot more pleasant now. Because no one likes going to the dentist, as we talked about
That's
before.
right. But they like going to you.
They like coming to me. Yes,
That's what
they
you
do.
said. All right. Now, you have more photos. We have time for a few more.
I do have a few more photos. This patient, again, he's known for years that he's had to have something done, and he did a lot of patchwork, just the same things we were talking about before, a crown, a root canal, a bridge. In fact, I think I patched that bridge about 3 or 4 times before he...
So all to save their teeth?
All to save his teeth.
They spend a lot of money on saving their teeth?
He spent a lot of money to save his teeth. And he told me, he goes, I know I'm going to have to get something done, but I just don't want dentures. Is there anything that you can do? And boy, when he saw his after, he was ecstatic. In fact, I'm going to be treating his wife very soon to give her her smile back as well. So with him, Randy, his options were a denture that comes in and out or a fixed set of teeth that don't come in and out. But he had spent almost a lifetime patching what he had in order not to have something to come in and out. And so we were able to accomplish his goal and give him a fixed set of teeth on the top and bottom that don't come in and out. And he couldn't be happier.
Well, it looks very natural. I'm not trying to, by the way, people need to know, I'm not endorsing you on the program, but this does look very natural.
It's very natural.
So what goes into the design? I mean, are you involved in any of that?
I am involved in some of it. A lot of the patients come in and they say, I don't want my teeth to look too white or too straight. In fact, some people ask for character in their teeth, sometimes a gap. But when we design teeth, we use this golden proportion rule where we look at those 6 front teeth and we know how they are to relate to one another. And I've done this procedure on several of my family members. I have 2 brothers that I've placed mini dental implants in, a sister, my husband's mother, my mother-in-law. She actually has been one of my patients for this procedure. And, you know, I could have put a conventional implant in her, or I could have given her a traditional set of dentures. But for her to endure that when I know that there's something that we could do.
I have doctors that always say about mini implants, they'll say, well, you wouldn't do it on your own family member. And I bet that the dentist on your show talking about mini implants would never do it on their own family member. And you're saying you're doing it on everyone that's missing teeth.
I've done it on just about everyone that's missing teeth.
Did
2
it hurt?
brothers, a sister.
Did they say it hurt?
They did not say, they said it did not hurt any more than what they would expect. It was an overall pleasant experience, much more pleasant than they believed. My mother-in-law in particular is very, I wouldn't say afraid of the dentist, but she does not like to be in the dental chair. And I actually, in one afternoon, was able to give her a fixed set of teeth on the top. And she walked out that day with teeth. She never went without teeth at all.
So does she smile more? Did you notice that?
Yes, she smiles more, and she eats a whole lot better, too. Do I have time for a couple more photos, Randy?
2 more.
Okay, great. This patient came in. She'd heard about the procedure through a family member of hers who I had done a similar procedure for. And she has always wanted to have something done with her teeth. Like I told you, they have most of their teeth remaining. And
but they're really falling apart.
They're really falling apart, and they refuse to have a denture made. And so we were able to place implants, and actually in her
She looks
case,
happy.
she looks very happy. Those actually come in and out, but she's a very happy person now that she can smile, eat more comfortably, and just be a lot more proud of her teeth.
So even 70s young today, but 80s, not, I mean, are they really self-conscious about their old-looking denture or their teeth? Even at 80, 85?
Yes, they are. And more importantly, they are self-conscious about those teeth having to come out at certain times. When you go into the hospital, they take your dentures. When your grandson comes to bring you something to eat, you have to sometimes remove your teeth, or you can't enjoy it with them at that particular time.
You make an excuse.
Yeah, you make an excuse not to have it. It is a life changer. It brings back a part of the socialization process that they have lost. Here's another patient. Actually, her grandmother brought her in. Her grandmother wanted to see her granddaughter smile again. And of course, she was eager to smile again too.
I mean, those teeth are pretty bad.
Randy.
That's got to be unusual.
No, Randy, this is not unusual at all. Maybe the reason we don't see it more is because they don't smile.
All right.
People think that they're unhappy most of the time because they're not smiling and showing their teeth. In this case, her option was a denture.
Boy, I mean, that's too young to be wearing a denture.
Yes, she's definitely too young to be wearing a denture, but anybody's too young to be wearing a loose-fitting denture at this point that's not retained or held in place.
So with
by
her,
something.
what'd you do?
With her, I was able to give her top and bottom teeth that no longer come in and out, and wait until you see this after.
Oh my goodness.
She's been totally transformed into a model.
It is like a model.
Yeah, she looks exactly like a model. One more, Randy.
All right,
I
all
just
right.
got to show you this one.
Got about a minute.
Yes, Randy. This patient came in totally disgusted with her teeth. She did not like them anymore. And I couldn't even save them. They had too much bone loss. They were really candidates to be extracted. But she held on to them until she figured out a way that they can be put in and not come in and out anymore. And so when you see her after, it's as though we took 20 years off of her
Let's take a
face.
look. So those teeth, wow.
Yes, she loved her smile. She's very ecstatic. I want you to look at those teeth though, Randy. Do they look like a denture?
No.
They
no.
look very, very natural.
It's like you're showing me baby pictures here.
We
I mean, you're proud of this stuff.
I'm very proud of it. We basically took about 20 to 30 years off of her appearance. She looks excellent.
We are out of time. Final message. Person watching this, maybe they're still skeptical. They're either a denture wearer or their teeth are bad. Maybe haven't been to the dentist in 15 years. But they're still skeptical or afraid. What do you say to them?
I say come in for a consultation. If you've been told that your teeth are hopeless and no longer able to be saved, if you have pain when you eat, if your teeth are loose, come in for a consultation. You will be amazed at what we can do. And if you are a denture wearer and those dentures are loose, you're not enjoying your food, you have that fear of them falling out, come in for a consultation. You will be surprised at what we can do with the amount of bone that you do have remaining.
Do they get to see you?
They will get to see me.
All right, great. Okay. Now we should mention, because we get emails about this, that Medicare, Medi-Cal, Medicaid does not cover these mini implants, right, here in the U.S. And most insurances just cover a small part, right?
That is
Even
correct.
if you have great insurance, but you'll work with them?
Absolutely. We have financing options. We will definitely work with them. Yes.
All right. I want to thank you for coming on the show. Great stuff.
Thank you for having me, Randy. It was a pleasure.
You've been watching The Wellness Hour. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.